We are Sylvia and Mitch Haber from Needham, Massachusetts.
We went on a week vacation to an all-inclusive resort in Montego Bay. It's about 2 days into it, Sylvia started feeling a little sick. And at first it was just some nausea and she wanted to go up to the room. That evening she was getting a little sicker and had some GI issues. On the Saturday, she spent most of the day up in the room. By Sunday, things were getting a lot worse. We had taken her down to the clinic at the hotel. Monday morning, she couldn't even stand up. So I'd called an ambulance to take her to a local clinic by the resort. The next morning, the attending physician says, "You need to understand how sick your wife is. She has, multi-organ failure, kidneys aren't functioning, we can't keep her blood pressure where it needs to be. She's developed a rash all over her body." And she starts throwing all these tropical diseases at me. She goes, "But the truth of the matter is it doesn't really matter because we just don't have the resources and she won't survive long enough for us to figure it out. So we're going to blast her with antibiotics, but you need to get her out of here. And that's the only way that she's going to survive."
We got a call that we were receiving a patient coming from the islands. I see a young 45-year-old that's intubated and is in critical shape. She came in complete shock. We didn't know what kind of shock it was. Blood pressure was very, very low.
Right after she arrived, that morning, she had a cardiac arrest.
They came back and said, "Well, she's stabilized. You just need to prepare yourself."
The doctors were trying everything. They were ruling out different bacteria, sending cultures everywhere, and we really couldn't pinpoint exactly what was going on.
She was swelling everywhere, there was a rash and there was blistering everywhere.
We're not a burn unit, but we had to treat her as a burn patient because of her skin.
On Friday, she was extremely ill. On Saturday, we can say that she was almost dying. It was around 6 p.m. when I heard the code blue.
I was just beside myself. Quickly, one of the physicians comes out and says, "She's in cardiac arrest. She's bleeding from her lungs. We're trying to get the situation stabilized."
Started a chest compression on her, started bagging her. She didn't have any blood pressure. We couldn't see any heart rhythm. And she was bleeding without stop from the lungs.
It was like an artery just broke, and there was blood just flowing into the vented tubing.
We just kept going. 20 minutes passed, half an hour, and nothing. Her husband and her family, I could see them crying. And it crossed through my mind how much responsibility we have and what a privilege to do what we do. We just continue. 30 minutes pass, 40 minutes pass, and nothing. One of our nurses, she shouted, "She has a heart rate. I can feel the pulse." But she couldn't stop bleeding from her lungs.
He runs out and he's covered in blood. And he says, "She's bleeding from the lungs. We can't stop it. We are going to try something that is not typical, and that's injecting factor VII into her lungs."
Which is a medication that been used for bleeding, but usually is a medication that is used systemically. We use it through the vein. He said, "Go ahead and do it," because we didn't have any other options. With a supportive respiratory therapist, we went in through the endobronchial tube, went into the lungs, and we put it in both bronchi. Gradually, we saw the amount of blood that was coming out getting less and less.
Then I hear, I don't know how much longer it was, 20, 30 minutes, a loud cheer.
Dr. Ferrer looked around and he said, "Nurse, thank you." And he looked at the other team. He said, "Doctors, respiratory therapists, thank you." And everyone just started cheering.
He comes out and says, we stopped it. He was so happy. Nurses come out, they're hugging us.
The team, they never gave up. They never gave up.
Through a period, probably a couple of hours, we managed to put it on the ventilator. It was around 10 p.m. when we finished it up. And I couldn't sleep, just thinking on her. Just thinking. She remained in the ICU more than a week. We were managing all the medications and side effects very carefully, yet we don't know many times what's going to happen afterwards. In terms of brain function and recovery, one morning she woke up and started interacting with us.
I do remember seeing my family around me. I slowly started remembering more and more.
It was just amazing how quickly she improved. We spent 21 days in the hospital, 14 days in the ICU, and 7 days in the step down before we left to Boston.
I feel incredible now. I get stronger and stronger every day. It opened my eyes up to the littler things.
From the minute I got there, I truly felt that I was in great, great hands.
Words can't even express how grateful I am for the team of doctors and ICU nurses that saved my life, and they gave me a chance to be with my family again. What can you say to thank people for that?